Welcome to A Higher Future in Healthcare, where we're exploring obstacles and solutions to healthcare's growing workforce demands. Tune in to hear from thought leaders as they share their perspectives on strategy, technology, AI, and people who are paving the way for transformative change. Welcome back to part 2 of our conversation with Dave Brooks and Karen Conway.
The human component clearly is key. And so, but what's interesting when you think about adaptation to, and keeping up and those sorts of things, then you start to get into the idea of technology and AI and, that conversation, right? Because more and more companies are leaning into the adoption of those sorts of things to move faster. And so how do you balance then what you're all talking about, this idea of partnerships driven by human relationships and trust and respect, with the need to move fast and adapt fast, but always maintaining that human in the loop, right? That human core of caregiving, that taking care of patients in the community. How do we not lose that, but be able to move into the future in a much better state?
It's all about the right tool for the job. Again, this is how my brain works. But where I'm most excited, it's like AI can't do everything, but it can do some very cool things. The area I'm most excited about, and this has a quality and a cost component to it, is about predicting future healthcare needs. So it's interesting. It's like Geisinger a number of years ago, when David Feinberg was still the CEO, they adopted a program where basically you had to opt out of having certain data collected to start to understand. And they also did focus groups to get the human element of the patient, but to start to understand what are going to be future health needs. Now, that's where, is this somebody who's likely to have an injury? Is this somebody who's likely to have their hip or their knee wear out? Is this somebody likely to get a chronic disease? I had to say that. But it's like, if we understand, if we can predict better, sooner, what the patient population will need. So individual patients, but then do it at scale. Then we can start planning ahead of time effectively to understand how we're going to meet those needs. And again, that might be how the acute care hospital is going to meet the needs, or it might be, hey, we need to have some kind of partnerships and make sure there's other kinds of resources that are available. That's very similar to kind of the example, Dave, that you were giving before. So that's about predicting. And that's about using data to make certain decisions. But healthcare will always require the human touch. Now, that human touch might be, literally, sometimes, my stepson's an orthopedic trauma surgeon. He needs to do his work hands-on. But, sometimes that healthcare can also be delivered in a Zoom call, at the end of a phone call, that visit by that peer manager. So again, then it's about determining, if you understand the needs, then you start understanding what kind of human touch is needed. Is it a doctor, a nurse, a social worker, etc.? And again, it's about managing to the needs of those patients that we care about.
Yeah, I don't know if it's generational or, my generation or if how much it permeates younger people, but I think you're right, Karen. I mean, the reality is we trust other clinical professionals with our healthcare. Now, if they are choosing to use technology and AI and other things to support them in the right way, I'm okay with that, right? But Dave Brooks, I'm not looking to not have a clinical professional of some sort helping me navigate, coordinate, think through my healthcare, right? I'm not looking to turn that over. Because I don't trust it. Maybe someday, again, maybe that's generational, both age generational, but even first generation AI in healthcare or whatever, and 2 or 3 generations of AI in healthcare, whether that's 2 years from now or 5 years from now or whenever that ends up being, maybe that will be different. The same way right now, I do now trust my Chase app on my phone to do all of my banking, where frankly 5 years ago, I still actually, although I don't know how the last time I've been physically into a bank, but at least I went to an ATM at a bank, and that seemed okay. Now I don't even go to the ATM other than when I actually need a physical bill. Other than that, cash, I don't even deal with an ATM. I just do it and so that, now we're into second and third generation banking technology and AI. I've accepted it and I trust it to a different degree. We're in first generation healthcare AI, so we've got to just recognize we've got to go through some certain cycles, and again, the intimacy of one's healthcare needs and expectations also probably affect how rapid, you used the term rapid adaptation earlier, will probably influence our acceptability of what is rapid or not rapid, right? If you think about it. So I think where technology and AI are there to serve and support care professionals, it's going to generally add value and be adopted and kind of move along. Where it's there to replace professionals, or it's there to create efficiencies, or it's there to you don't need a person to do this, let's use a machine to do it. That, I'm not saying that won't always dollars and cents wise make sense. I don't know how quickly we'll adapt that or allow that to happen, both as the healthcare systems or providers, but also even then the consumer, the patient, the family, the community. I think we're not there yet.
No, you bring up a really good point, though, Dave, is and there's kind of two sides to this. Everything in my life I've always looked at as both and, not either or. So one, what's our responsibility as patients? We have historically, and those of us who have been around longer, it was much more of you just let the doctor decide. You know what? We need to take more responsibility for our own health. At the same time, just solely relying on, and I'll use a current example, how many people have gone, well, I'm going on WebMD and I'm gonna put my symptoms and it's gonna spit out the answer. Well, you know what? We are not trained in medicine, and so we don't know how different parts of the body interact, et cetera. And the other fact is, it's not just about the physical. It's about what's happening in your mind. It's also about preferences. Some people are very risk averse. Some people are not. Some people have the financial capabilities. Some do not. It's about treating the whole person. And I want to go to those professionals who have expertise in a variety of areas. The one thing is I would like the healthcare professionals across that entire continuum to work a little bit more closely together and share. I've got a friend she's got Parkinson's. She's about 15 years into the disease. She has 9 different specialists that are working together, and she's making sure they all talk to one another. So how can we use perhaps AI to support that? So let's look at technology shouldn't run things. We should determine how technology can help us optimize what we do.
It's funny, within the last day or two, one of these many emails we all get with, updated news and healthcare facts and figures, modern healthcare, whatever it might be. There was something I remember seeing within the last day or two that talked about the accuracy of AI in clinical care, and it was like 70-something%. I forgot exactly what it was. And it's 70-something% accurate. Now, I don't know what that, I didn't read the whole thing and read the study. It was almost more the headline. And then I thought to myself, I wonder what the human performance is. It's not 100%. I mean, caregivers don't get it right. And I don't mean malpractice. I just mean, complicated issues that it doesn't always work perfectly or is understood perfectly. So it's not 100% either. And then I thought to myself, okay, so let's give humans the benefit of the doubt. Let's say they're 85% and AI is only 75 or 72 or whatever percent it was. So obviously it's outperforming it. But what happens when you put it together?
Yeah.
So does all of a sudden it become as a combined model? Is it like 90% also? When you take the human at 85% or whatever, and I'm making that up, and AI at 72%, and I'm making that up separately, but when you combine the two together, I would assume it's got to raise above that maximum currently at 85 to something better. What is it? And how do we start thinking of it that way as an enabler, as an enhancer versus a replacement? I think that's the part that's scaring people right now, both caregivers, but also patients and communities, and why the regulators are going to get involved and all this type of thing is it's seen, like you were saying, Karen, as kind of an either or, not an and, right?
Yeah.
Not a combined between the two. How do we figure out how to do that?
Yeah.
I mean, it's part of what our right. Go ahead, UB.
Well, I was just going to say it's such a good because one of the things we're going to do after this is follow up with an article that will kind of, and I think this actually is a good conversation to have in that article in terms of, because for me, I feel like the biggest issue is how we introduce these concepts to people and how we define these things, right? Mm-hmm. So if we're coming out of the gate saying that AI is going to solve all our problems, well, then we've now set that expectation unrealistically high. And so, of course, everybody's going to either be scared of it or think it's going to solve all our problems. And neither happens, but and we end up at 70%, and so it's like, we're not setting the right expectations. And I believe part of that is the responsibility of leadership to come in and define these things and introduce these things to their workforce and really, say, look, this is why we want to do this. And this is how it's going to help all of us be better at delivering care. And so I want to leave that dive in, conversation for the article. But I think, I see this just in general across the board, marketing sometimes is not a good thing. It doesn't do the right thing that we need it to do to spread the right message. And it just confuses things and it causes fear. I think we see a lot of that just in general. And so how do we avoid that? And I think that's where leadership can play a big part. But so let's leave that for that. How about one last kind of like thought-provoking, leave behind from each of you to close us out, just, around what we've been talking about.
Dave, I'm going to let you go first.
What's that?
You're first, Dave.
Oh, okay.
Passing the buck.
I'm going to launch. All right, I'll do it that way. Karen, you get to be the closer. You get to wrap it up there, which is probably good, smarter. But I am going to launch a little bit on what you said. Let's leave for the article because I do think it relates to it all. It's again, from whether it's technology or AI, and I'm still struggling with kind of. I think there's a difference between the two, but I don't know if I can explain it as a non-technical person. But I'll lump it all together, kind of as using machines to enhance or be involved in processes versus humans only. And I do think that connecting that with what you were saying about leadership, it's going to be a lot of this is going to be about being willing to trust our teams. Right? Mm-hmm. If the C-suite says we're going to be bringing this technology or this AI in to help make, I'm from administration, I'm here to help, or whatever the cliche is, or orders from headquarters, or whatever the bad cliches were about us suits when I was a suit. If we're bringing things and telling people, here's how to improve your work, or you need to do this, or whatever. It basically says to people, we don't trust you. And I think if we start saying, we trust our teams, we as a collective team need to figure this out with whether we are automating processes or we're bringing AI in, if there's a difference between the two or whatever, let's trust our teams to help us figure that out. And I don't mean let's have a nurse who's now the chief nurse information officer figure it out. No, let's have the nurses, the staff nurses be involved with that. Now, a good leader, a CNIO leader, will know how to do that and bring that in versus be directive, right? But I think we're going to have to figure out in a different way than we've done it in the past how we trust our teams to help organize and solve this. It can't happen out of the C-suite or out of management alone.
Yeah, I think, absolutely. And I look forward to exploring all of those concepts because I think you're spot on, Dave. I think I'll just end with just a thought in terms of perspective. I thought it was interesting, your point you made earlier about kind of when we went from a situation where you had kind of a cottage industry, you had different hospitals and healthcare systems saying, hey, I'll do this and you do that because that's what's going to benefit and we're not going to duplicate. Then for a variety of reasons, right and wrong, moving much more to this market-based. But I think we've created sometimes this assumption in healthcare that it has to be highly, highly competitive and that we can't be successful unless we are. And that I disagree with that. And I think we've got plenty of examples. I had the opportunity about 10 years ago, co-wrote a book on global leadership. And in that had a chance to interview about 10 different global leaders, one of whom was Jim Whitehurst, CEO of Red Hat. And he talked about how this open source approach, this very collaborative approach, they basically gave away, the IP to some of their competitors. But because of other things, their service approach, et cetera, they actually continue to do better than their competitors. You see this now with Tesla. And people starting to partnership and using some of their technology, whether it's for, the batteries or whether it's for the refueling. And I've had a personal example, worked for over 2 decades with a technology company that was started by 5 competing healthcare suppliers, Johnson & Johnson, Baxter, Abbott, GE, and Medtronic. And they came together and they said, you know what, we all have a shared problem. And we can either spend a bunch of money duplicating our solutions, or we can come together. And even better yet, they said, you know what, we've got to create a solution that is supporting the needs of our customers. So a solution that solves the problem for everybody. It's the idea of where is it best to collaborate and where is it best to compete? And you can do both. And so I look forward to being able to look at that at multiple levels in the follow-up blog we'll work on.
Yeah, I love it. Well, I can't thank you both enough. This has been an amazing conversation. I mean, clearly we could go on for so long to talk about these things because these conversations need to happen, right? And so thank you both very much for your time. Thank you, listeners, for tuning in, and continue to check out our series here at A Higher Future in Healthcare, because we're going to keep having these conversations and these follow-up articles and those sorts of things. So thank you all again. Thank you, Karen and Dave. It's been great. And we'll check you all next time. Take care.
A Higher Future in Healthcare is a production of IIA Healthcare, a healthcare technology company and creators of Interview IA, an interview platform for healthcare organizations to streamline their interview processes to deliver unparalleled candidate experiences and to create a true competitive advantage for delivering quality care. Learn more at www.iahealthcare.com.